okay, over the last 34 years. So the key element is that a mini zone is parallel to the skin. It is tenser, more hypercontracted than the tissue surrounding it. So then within that, they're going to be vertical to the bone. There are going to be what are called yang block subos, or trigger points. Okay? There's going to be 2 to 3, usually 2. And I need to find those access points, because by releasing those access points, I'm going to reduce the intention reduce the tension over the entire mini zone. Okay? So like, I'm going to go from bone to bone. I'm going to find all the mini zones, which will be 2 to 3. Then I'm going to take the biggest mini zone. I'm going to cross fiber. Sweeping is going along the length of the musculature. Cross fibering is going perpendicular. Okay? So this is cross fiber. This is sweeping. Sweeping is a very advanced technique. Cross fibering is an intermediate technique. Okay, it's one of the things you need to practice in the very beginning. Sweeping is when you're really, really good and you've been doing it for years. Then I can come up and I can find mini zones faster. Okay? But for the intermediate student, you're going to have to do all of the steps. Okay? It takes years and years to get down. And you don't want to just copy someone who's been doing it for years. You want to actually feel the mini zones, actually feel the yang block subos, then do our full rotations. So what we want is an LVPD, a location, a vector, a pressure, and a duration for every point that we treat. So treating from bone to bone, I find all the mini zones. So she's got a mini zone going right here that's 1 by 3. Okay. Then she's got another mini zone here on line 4 that's 1 by 2. And then she's got another mini zone here that's just supraclavicular, and it's just up there, and that's a 1 by 3. So my biggest mini zone is this 1 by 3 here. So then I cross fiber, and I only cross fiber the size of the mini zone itself. Okay, and I find that she has 2 yang block subos here. I need to determine which one is the biggest or most sensitive. Okay? Now your client can give you feedback. So you can say, using an even pressure, which one feels more sensitive? This one or this one? The second one. Okay? So that will help train your touch, that you'll be able to feel this as you do it, but you can always confirm by your clients. Okay? They're always going to tell you which is going on. So now I've determined L, location. So I get centered right on that. The individual subos are going to be no wider than your finger. So when I get centered on that, then I have to do a full rotation. By that meaning that I have to rotate all the way around so that all my potential vectors have been checked. Okay? This is what I call short rotations. Okay? And it's very common with new students. They just kind of go around and then they just kind of guess. What you want to do is pay close attention, move slowly, and find the vector at an even pressure that is most sensitive to the person. So I say, okay, tell me when that feels most sensitive to you. Right there, okay? Then I shift my position so that I maintain my Michelangelo arms, my gentle curve to the arms, my hand flat along line with my forearm, no bent joints. I increase my pressure by raising my elbow and coming back to that ideal vector. And then I'm going to hold until I feel the subo, which starts out feeling like a closed fist, just open, like a rosebud blooming. Okay? When you feel that open, then you know that segment has opened. Now there can be up to 5 segments at that same location going all the way to the bone. Usually there's 2 to 3. Okay? So after my first segment opens, I'm going to stay at the same location and re-rotate to see if I find another segment, okay, which I do at this vector, yes? Okay. So then I increase my pressure by slightly raising my elbow, increase the pressure until it feels significant, but it doesn't cause her to try to avoid. It doesn't cause her to try to pull away. Okay. And then when I have it accurate, it should be no more than 30 seconds. When I feel that segment open, Then I again rotate a third time to see if there's another segment, and I don't feel one. Actually, there is one deep right in there, yes? Okay. So there can be, you have to look closely because it can be sort of subtle. So I find the third vector all in the same location, 3 different Tsubo segments. Now, when that opens up, that has changed the whole. Now, the mini zone that was tense over this whole 1x3 area here, okay, has now changed dramatically. It's not perfect, but it's much, much, much better. The tonicity of the tissue changes. It takes a little more time than just the time you're treating it. But what it'll feel is smooth. Instead of having those hard lumps of those yang block subos in there, it will smooth and feel much more comfortable. The person, they'll be able to tell the difference to you. Okay. So then I'm looking for, so it's the 2 biggest mini zones. So I go and check. Now, when you do the biggest one first, often the lesser size mini zones will open up with the larger one. If you do the biggest one first in triage, it's the medical terminology for most important, then next most important, then next most important. You do the largest mini zone first, often, if not always, a good part of what's left of the other mini zones will go with it. Okay, it never works in reverse though. If you do the smaller ones first, they don't take the bigger ones with it. So that's where efficiency and time management is crucial, that you get the largest sumo first. Okay? So again, my beginner treatment was point by point along all 4 lines going from bone to bone. My intermediate is to cross fiber, find the biggest mini zone, find the biggest subo in the biggest mini zone, open all the segments of that, then that opens up the mini zone and takes most of the rest of it on that entire side of the neck. So after having doing the right side of the neck, I do the same on the left side. Okay, so I find a mini zone here, on line 2. I find a mini zone here on line 4. There's only 2 on the left side. So I go to the biggest one and I cross fiber just the mini zone, which this one's 1x4. So I just put my 4 fingers down and I cross fiber. Find the biggest subo in the biggest mini zone, do a full rotation. Okay, does that feel like the most sensitive angle to you? Okay. Then I again shift my position to always be comfortable. Okay, you don't want to lean and strain. You always want to keep in perfect balanced position. In my clinic, I work 12 hours straight. So I don't want to injure myself, and I want to make it through the entire day, with the 12th treatment being as effective as the first, which you're not going to do if you're fatigued. Okay, as that opens up that whole mini zone. The head does move, so you can angle to make sure that you're getting all aspects of the mini zone that you're looking for. Okay. So having done both sides of the neck, I'm going to shift over and do the cranial release. The first one I'm going to do is the frontal bone. I'm going to take and I'm going to find right where the nasal bone meets the upper orbit, and then 1 cun or 1 centimeter directly superior, there's a fossa. I'm going to contact those 2 points. My vector is going to be directly away from the face or up. Okay, and I'm going to hold that for 30 seconds. My second point is I'm going to follow the orbit until I find what I call the location fossa, which is at the end of the natural eyebrow. No matter how their eyebrows are shaped, at the end of what would be called the normal eyebrow, there's going to be a fossa. And then I'm going to go for the zygomatic bone, 1 cun directly superior. Because of the plasticity or elasticity of the skin, once I find that point, I want to release and recontact. If you don't, the skin can pull away, and then when you go for your inferior vector, it'll slide off your point. Okay? So I find my point, release, recontact, and at first, I go inferior vector, directly inferior, parallel to the coronal plane, which is the table.